What are strategies for shelf exam question stems? Imagine you're in the middle of a busy hospital ward and a patient walks in with chest pain. Now, think about how you would approach a question about this scenario on your shelf exam. The key is to treat each question like a real clinical case, not just a test prompt. Start by identifying the patient's main complaint, the relevant history, and physical exam findings. This helps you build a mental picture that mirrors what you see during clinical rotations. Next, pay close attention to words like most likely diagnosis, next best step, or most appropriate treatment. These clues tell you what the question is really asking for. Recognizing these keywords helps you focus your thinking on the right part of the case. Developing pattern recognition is also important because many shelf questions repeat core concepts in different ways. For example, a question about a heart attack might look different but still test your understanding of myocardial infarction. When reading the stem, do so carefully but quickly. Read the entire question to get the full picture without getting stuck on every detail. Then, glance at the answer choices. Use a process of elimination. Cross off options that are clearly wrong. Narrow down your choices to the best answer that fits the scenario. Managing your time is essential. Usually, you have about 1 to 1.5 minutes per question. If you find yourself stuck, mark it and move on to avoid wasting precious time on questions that are easier. In clinical rotations, think in terms of algorithms for common problems. For example, if a patient has shortness of breath, consider the most common causes and what the next step would be. Focus on recognizing typical inpatient issues like hypertension or outpatient conditions like diabetes, as these frequently appear on exams. Studying with real clinical cases helps solidify your understanding. Reviewing cases from your rotations on the same day can make a big difference. Practice questions from trusted sources like UWorld or Amboss to reinforce your knowledge and build confidence. Remember, the main strategies are to treat each stem as a mini clinical case, identify keywords, recognize patterns, read efficiently, eliminate wrong answers, and manage your time well. Thinking in terms of clinical decision-making and integrating your hands-on experience will help you answer questions more accurately. Keep practicing these techniques, and you'll find yourself more comfortable and prepared when exam day arrives.